to Know Your Health Tuesdays with me, Dr. Lesego from Blue Heart Medical. I'm quite excited to give you a new installment, and our questions today are centered around UTIs. So I've got a couple of questions, but firstly, let me just explain what UTIs are. UTIs is an infection anywhere along the urinary tract system. We usually say it's bladder infections for the sake of, it's just a colloquial term so that everybody understands what we're talking about. But the infection could literally be anywhere along the urinary tract. So it could be in the urethra, the bladder, the ureter, or the kidneys. So the first question says, do certain medications cause side effects, especially to the bladder? There are medications that can cause effects relating to the kidneys particularly. So if you do have kidney issues or any condition that could compromise your kidneys, it's quite important to check which medication you're taking and make sure that it doesn't compromise your kidneys any further. The next question says, can one randomly develop a UTI, or is it caused by other factors? So this is quite a good question because there are people who get recurrent UTIs. That's 2 or more UTIs within a space of a month or so, or 3 UTIs in a year. So then they start questioning, what is causing UTIs? Why do I keep getting them? In women, it's just our anatomy. So our urethra is very close to the vagina and the anus, and the germs then travel quite easily. So it's recommended that you always wipe front to back, never back to front. So that's whether you've passed urine or passed stool, you always wipe front to back. Another thing is making sure that you drink a lot of water. Keep yourself hydrated, because if you don't drink a lot of water, then you don't have a lot of urine, and you find that the germs are concentrated and they may stay for a little bit longer than they should, and they can actually multiply easier that way. So if you keep drinking a lot of water, you flush out your system. You do end up going to the bathroom more often, but at least your system would be flushed out and you would reduce your risk of getting another UTI. Other causes include obviously public toilets. A lot of us experience, not a lot of us, a lot of people experience UTIs from public toilets. We tend to want to avoid them, but there's times where you literally just can't avoid using a public toilet. So what I would recommend for women is, if you do have to sit, make sure that the toilet seat is clean, very clean, so you can carry a little sanitizer with you, wipe the seat, and make sure that you put tissues in the bowl so that when you do urinate, it doesn't splash. So what you need to avoid is the splashing. If you can, don't sit, although I know other people do recommend that you sit to try and avoid the splashing, but if you put enough tissues in there, you shouldn't splash. Another very important thing is hygiene. So I'm talking a lot about women because women often get UTIs compared to men. So with women, hygiene as well. So when you are on your period, make sure that you change your pad or your tampon every 4 hours. So even if the flow has started to slow down, we tend to just relax and just leave it for however long because there isn't much in there. But try and change every 4 hours. Wash your hands before and after changing. UTIs can actually also be sexually transmitted. So it's both for men or women. It's important to test and see the urine, whether it is or what the cause could be. For women, it's recommended that after intercourse, try and urinate as soon as you can after. Drink a lot of water as well to try and flush out the system. And again, always wipe front to back. In terms of what else can you do in terms of reducing the risk, I mentioned drinking a lot of water. Some people say cranberry juice as well. I mean, I don't know about the scientific evidence of cranberry juice, but I mean, it can't hurt. So I would say go ahead, take your cranberry juice. If it's helpful, great. People talk about citrus soda as well. I don't necessarily recommend those, especially if you do have a UTI. It's quite important that you go through to your doctor and get treated as soon as possible, because there are complications that can actually occur from a UTI. So firstly, we don't want the UTI to spread to the whole urinary tract system. So it might start off in the urethra or the bladder. It can actually track backwards right to your kidneys. And a kidney infection is very, very serious. It can cause damage to your kidneys. And your kidneys are a vital organ, so you can't survive without your kidneys. So it's very important that you treat your urinary tract infection as soon as possible. I know some people wait and they'll take your citrus soda, cranberry juice, but it usually doesn't work because it's a bacterial infection. So it's important that it be treated with antibiotics. which is why you need to go through and see your doctor. Another side effect or potential side effect is septicemia. It is less common, but it's very, very serious. That's where the infection spreads to your bloodstream and it spreads all over your body, and it is also very dangerous. So you need to be admitted into hospital, treated with a drip and IV antibiotics. So let's not take these UTIs for granted. Let's get them treated as soon as possible to try and avoid any sort of complications. Other things, okay, I mentioned female hygiene, hand washing, your period. We need to, as women, avoid putting things in, whether it's douches or spermicides. Using diaphragms or spermicides actually also increases the risk of UTIs because, you know, it changes the pH, etc. of the vagina, because and that area down there. It increases the risk of getting UTIs as well. I have another question that says, can you discuss the role of antibiotics in treating UTIs and the concern over antibiotic resistance? Very careful with how we use antibiotics. So a lot of my patients will know I don't just prescribe antibiotics unless if they're absolutely necessary, because if you use an antibiotic for a viral infection, it doesn't work. Antibiotics don't work for viruses. So if you do have a bacterial infection, antibiotics do work. So if you have flu, for example, a lot of patients will say, I've got flu, I need antibiotics. You don't need antibiotics for flu because flu is a virus. It doesn't work for bacteria. And what we find now is that there's a lot of antibiotic resistance. So they're not working anymore, because when you give antibiotics when they're not necessary, the bacteria that are there end up getting used to the antibiotics, and next time when you want to prescribe it, it doesn't work. So it's quite important that we only give antibiotics where necessary. If you do have recurrent UTIs, I would recommend that you come through for testing. We can test the urine. We take a sample to the lab and they can tell us what bacteria is there and what kind of antibiotics work for it. Because there's so much resistance, there are cases that we're seeing where the usual first-line antibiotics don't actually work anymore. So it's important that we get the urine tested if it is a recurrent infection. What are the risks of untreated UTIs? I think I've actually spoken to this already. So the risk is the fact that it can actually spread higher in the urinary tract, all the way up to your kidneys, which is a very serious infection. And you could actually get septicemia, which is where the bacteria enters into your blood and spreads all over your body, which also is very dangerous. So I would recommend, as soon as you feel any kind of symptoms of UTI, go through to your doctor, come through to us, we will help you. We are based in Centurion, Cosmosdal, in the Cosmosdal Center. We are downstairs. Come through, we are more than happy, or I'm more than happy to help you. Our number, I just want to give you our numbers there. The cell phone number is 069 114 3962. That's our WhatsApp number. And our landline is 012 493 0770. Until next week, Tuesday, keep well and keep healthy.